Throughout life, we will experience different situations that help shape who we are. There will be positive situations that develop a positive state of mind, negative situations that provide a strong character. But in every living thing, there comes an end. Every individual will experience it one way or another, whether it is that individual or a close loved one. These situations can develop fear for ourselves and for others. It is unavoidable, inescapable, unpreventable, inevitable. Thanatophobia. Throughout history, thanatophobia can be seen in many different forms. In general, the most traumatic events were a huge indicator of such fear. These events include 9/11, the Vietnam War, Pearl Harbor, bombing of Hiroshima and Nagasaki, the Holocaust, and much more. It created fear in everyday living individuals and forced the leaders and society to react. The fear served as a defense mechanism to prevent more lives from being lost. After 9/11, American Muslims and Middle Easterners were mistrusted and the society had prejudiced thoughts towards this specific group. It also caused the focus of the United States government to lean towards immigration laws. These reactions can be seen in most any events. Pearl Harbor brought the United States into war in fear of more invasions. During this period, many United States citizens discriminated against Japanese Americans. They placed the Japanese in internment camps in fear of betrayal and of terrorism within the country. The fear of losing someone during these times of war caused people to inhumanely treat American citizens for their backgrounds. The United States resorted to nuking Hiroshima and Nagasaki to prevent risking any more American lives. The history of thanatophobia can be described as a complication of conflicts between man. The fear of death or the fear of losing loved ones is a natural instinct that calls for protection. Throughout time, fear demonstrates a reason to act and protect. It is important to recognize the history of thanatophobia to help explain why we act on fear, or why we have it in the first place. Not everyone who has a fear of death deal with the same issues as the rest of society, but most everyone acts on fear to make a change or to avoid danger. The significance of the fear of death in history does not deal with the specifics or the extremes of fear, but it does give examples in which an entire society might have feared death at some point. The most recent events that impacts modern-day society are school shootings. Today, many of the parents in the United States fear for our children's lives because of recent mass school shootings. Parents and students are fighting to change the law to possibly prevent further dangers. Again, it is important to recognize that there are different levels of thanatophobia and different reasons to why a society might have them.
My name is Nikki and I'm a CNA.
My name is Ruth Royston. My profession is a professional nurse, RN.
Christine Data. I'm a registered nurse.
My name is Mandira Basne. I'm a registered nurse.
Joshua Overly, respiratory therapist.
My name is Emily. I'm a registered nurse.
My name is Sharon King. I'm a registered nurse.
Well, I'm a CNA and a nursing student, so I've had to deal with death or the process of dying with patients. I've had to do postmortem care.
When I was in nursing school, we studied the Kubler-Ross stages of death, and when I've had 40 years worth of nursing and dealing with death, I worked in an oncology floor before also, where that death was very prevalent.
Yes, I would say in my field, we deal with death and anxiety quite a bit as we have patients come in that are oftentimes really sick or terminally ill. So sometimes they make it, sometimes they don't. In nursing school, we kind of go through different theories on grieving and death and how to help people cope with it, and strategies where instead of kind of saying our own opinions or putting our own feelings onto our patients and their families, we just kind of try to be more of a listener and just kind of a compassionate spirit versus intervening and putting our thoughts and beliefs onto them.
The qualification I have is the more thing is experience because I work in a healthcare facility. Others, I got education on that.
We see it all the time.
Communication skills when becoming a nurse, and so having good communication and therapeutic communication with patients is something that really makes a difference.
So I would just say my background as an experienced registered nurse. I've dealt with people in many different phases of their life. I've dealt with people who are with family members who are dying. I've dealt with people who are dying. And in my personal experience, caring for like my family members who are dying.
I think so, yes.
I think for majority of people, it's the fear of death is inevitable, but I think that those that have a really strong faith about, good things to come when they pass, they're not afraid. Those that are tried and true in there, that they're going to go to heaven. And
I think everyone has a level of fear of dying because we don't really know what comes next. A lot of people, especially that have strong beliefs, and I would think religious beliefs, what I've typically seen, are more comfortable with that. I don't think everyone is afraid. Some of the people I've talked to were not afraid. I've also dealt with some people who are very afraid. So it's very individual.
Thanatophobia, like some phobias, can be caused by experiences in an individual's past. These experiences can be traumatic events related to a death of oneself or a close loved one. On the other hand, a severe illness of thanatophobia may be caused by the person's psychological distress about dying. They are anxious about dying even if they are young or are not severely ill. Research demonstrates that younger individuals, ages 18 to 30, are in general more afraid of dying or the dying process than those 60 and above. It is most likely due to older individuals who have already experienced life and all that they ever will do.
A person can fear death more than another individual according to their culture, religion, or family values.
Like for me, I'm Buddhist. We have when someone dies or they're in the process of dying, we have a whole ritual we have to go through. And then when they are dying and they're dead, we just have a lot of stuff that we have to do.
Okay.
So then we're already prepared for the death, I guess. So then it's not as bad.
Is structured around what you believe, what you believe is going to happen to you after you die. If you believe you're going to, burn in hell versus walk in front of the gates of heaven, you'd be scared if you were going to burn in hell.
So I am a Christian. I don't go to church every Sunday, but I know with a lot of people, believing in something higher helps them cope or deal with it because then it's not a final stage in the circle of life.
Religion can impact the life of an individual and even the views of death. People who believe in an afterlife or a God will generally be more willing to accept their faith because it will grant their soul immortality and freedom. These individuals will less likely be impacted by fear and will generally live their life with purpose behind God's will. In some cases, those who are more educated and have higher income tend to view death as important and/or fear the coming of death. Being more educated tend to drive people away from spiritual beliefs and believe in non-existence after life. Thanatophobia is a very serious psychological fear that can be short-term, 1 year or less, or long-term, more than 1 year. It is very important to recognize that diagnosing an individual with a phobia, disorder, or any mental issue is a very complex system and needs to be done with care. This is to avoid misdiagnosing an individual. DSM-5 is the diagnostic tool used by healthcare to diagnose an individual with mental issues. According to DSM-5, to be diagnosed with a serious or extreme phobia, it needs to be excessive fear. The person should exhibit an unreasonable, persistent, and intense fear triggered by a situation or object. It needs to be an immediate response when interacting with that stimulus. The sufferer goes out of their way to avoid the stimulus. The phobia significantly impacts the sufferer's daily life, and this needs to have been going on for 6 months or more. Please note that this phobia cannot be caused by another disorder. Thanatophobia, however, can be linked with post-traumatic stress disorder, panic disorders, and illness anxiety disorders. Now that we have discussed DSM-5's diagnostic criteria for declaring someone with a phobia, let's further the diagnosis by focusing mainly on thanatophobia itself. Thanatophobia is the fear of death, the fear of your own death, and the fear of losing someone to death. It is not, however, necrophobia, the fear of dead bodies. Thanatophobia focuses on the fear of the dying process. The symptoms one exhibits with thanatophobia are that they enter a panic state when thinking about death, they get depressed or anxious around an individual or themselves dying, and or avoid being harmed or avoid dangerous or seemingly dangerous situations. There are many factors that can generate how people view death and fear, but depending on the level of fear, it can impact the individual in various ways. It is important to consider the past and the current mindset of the individuals to determine the impact death will have on them. On the other hand, death is spontaneous and can occur at any point in one's life and possibly changing their perspective on death. The effects that death has on individuals comes drastically to those who have lost or are going through a situation of trauma revolving around death. According to the experiences of a well-adept nurse who was in the fields of war and works in the emergency room, Mrs. Sharon King, the nurse of Stafford Senior High School, saw that death is more prevalent in those who have been through war or the loss of an individual. She confirms that it is not usually the one who dies that fear death, but the family and friend that cares for that individual. For those who suffer from a serious mental illness of thanatophobia, it has impacted their lives more than ever, preventing them from experiencing activities that has any relations or risks to death. It can be a huge wall for that sufferer and may pose a problem in future situations.
There are guaranteed things in life, and death is one of them.
Mm-hmm.
But it helps it kind of, I think death is one of those subjects that's difficult for people to talk about because not everybody's comfortable.
Mm-hmm.
So it kind of talks about, especially when people have a medical diagnosis that leads to death, not everybody, like, it talks about the elephant in the room that nobody will talk about. Does that analogy make sense? But I have a book, and I'll share it with you.
Mm-hmm.
But it goes through dying and different types of death because, death by suicide, death by, medical, it could be a trauma. There's lots of different types of deaths, and when people have death that occurs from different ways, how people can help to deal with it.
In therapy, patients can go to grief counseling, they can have pastoral care, they can have religious, their family members can go, and that can help with the fear of death.
There is like pharmacological and non-pharmacological practice. The people can take medications to make them calm and then get rid of all those fears.
Support system, like such as a spouse, family support, friends, having a good religious base, or if you don't have, if you don't believe anything, staying true to that too, I guess.
Just sitting with them, just offering yourself and letting them talk about it.
Okay.
I think that's, just letting them talk and be open about it.
There are more than one way to deal with fear. Each individual will cope with death in their own ways. If one does not know the path to dealing with a phobia, there are many techniques provided to guide the sufferer to the right path. Some examples include group therapy, where you discuss your problems in a group setting, talk therapy, where it's in a client-to-therapist setting, religion. Having religious support or even joining a religion can help remove certain fears of the afterlife. Art and entertainment. This will distract yourself from reality and the thoughts of reality. Palliative care, where nurses become your support system in dealing with death. Medicine, which lowers the production of certain hormones that influence depression. Virtual reality, that help provide an experience that the individual may have feared never experiencing in their lifetime. And family, which can be a support system that help and guide you towards peace and acceptance of death. Although there are many different ways to deal with thanatophobia, not all of them may work. Sometimes an individual's fear for thanatophobia will exceed the motivation to heal, diminishing the chances of recovery. The many different methods may help lower the reaction of fear, but it may never cure it. Thanatophobia is a very controversial situation in that the fear can sometimes be incurable and impossible. It does help to seek assistance and find a cure, but without the motivation from the sufferer himself or herself, it will prove to be difficult to recover. In conclusion, the fear of death can happen to anybody. The intensity of fear may vary from person to person, but it is also important to recognize that fear can be taken care of in many different ways, and that it should not shape how you want to live your life. If it does, however, and you don't know how to deal with it, seek help from a trusted individual or a healthcare facility. It really helps to reach out and move towards a better life. The motivation to change is key to starting towards a heal or a fix, but it may never go away. The fear of death may resurface as you live your life and go through traumatic experiences. That being said, you should not try to focus on the future and try to live your life in the present. Although it is hard to avoid thoughts of what happens after death, it pushes you away from what reality truly has to offer. Thanatophobia has many different treatments, and one may work for all. It is important to recognize that life is just as important as death. Thank you.